Hi, I'm Pat Tarnowski. I'm a physical therapist and the Chief Commercial Officer for OneStep. We're building OneStep to help people like our providers, patients, and partners understand the importance of gait and mobility as a leading indicator of health. There is a deep body of scientific literature that correlates gait and mobility to important health risks like falling, morbidity, mortality, hospitalizations, cognitive decline, and falls. We've built OneStep to help serve large populations of partners. We're working with providers in, say, senior living, substantially based on our ability to identify fall risk and help them prevent the fall before it occurs. We built this to help partners like health systems. So we're working with large health systems across the United States to help them address the needs, mobility needs of patients with neurologic disease, orthopedic conditions, as well as cognitive decline. We've also built OneStep to help serve medical device partners. We've integrated our unique algorithms into the experiences of other medical device partners to help them measure and monitor this important mobility vital sign across their entire ecosystem of patients. And finally, we've built OneStep to help support those that are in risk-bearing agreements. Payers, providers, device companies, pharma, big technology, so that we can help, again, measure this very important vital sign in a way that has previously we've been unable to do. We started OneStep with the idea that we can help people move better. One of the problems that our industry experiences is not being able to get data in a clinical setting about how somebody is moving, but to do it easily, to do it cost effectively, and more importantly, to get information about how somebody is moving in their natural environment. With big gold standard gait labs that are very expensive and hard to use, not very practical, it gives providers like me just a snapshot in time about how our patients are moving. What OneStep has been able to do is now use the power of smartphones to be able to capture clinically validated data passively in a patient's natural environment. And we understand the importance of how somebody's moving in their natural environment as an important contributor to overall health and helping providers be much more effective in their interventions. So we make OneStep accessible to our partners by working directly with us. We will license all of our technology to our provider partners. Our partners then use OneStep in a clinical setting with their patients. And part of the benefit of what we do at OneStep, given that we're operating on a patient's own phone, simply by putting a phone in a pocket and walking 10 to 20 steps, we're capturing clinically validated data about how they move in their natural environment. Our partners will assess the patient using OneStep in a clinical setting and then show the patient their own data and then extend their care model by saying to the patient, we would now like to be able to measure and monitor your performance in your own environment. So we will allow the providers then invite the patients to come into their environment of OneStep and take OneStep home on their own phones. As we close, very important, I think, for our audience to understand gait is indeed a sixth vital sign. By using new technologies like OneStep, we can now measure and monitor this important vital sign in a patient's natural environment. In fact, the way that we move is indicative of health. From OneStep, we believe every step tells a story.